Hi, I'm Jen Taylor Campbell. I spent 12 years as a birth assistant, lactation consultant, and childbirth education trainer in the Bradley method and birthing from within, and ran La Leche League meetings with a passion for supporting women who have become moms. Currently, I'm a certified birth doula for all happy births, regardless of where and how you deliver. I'm also a bereavement doula, helping families struggling with grief and loss from miscarriage, stillbirth, NICU, and fatal diagnosis, as well as an adoption and surrogacy doula and a certified lactation educator. In addition to my doula training, I have 30 plus years in the trenches on my own journey as a mom. I'm mom of 18, and yes, that's 18 kids. I've written a blog since 2011. I'm a published author of a self-help memoir since 2016, and I'm the host of the Becoming Parents podcast since May of 2017. I am a speaker and have 15 years of experience in the foster care sector as a parent and a trainer. I've received targeting training on topics such as crisis intervention, drug and alcohol addiction, surviving trauma, and suicide prevention, which has equipped me with a solid understanding of how to serve others who are experiencing trauma. On December 1st, 2022, I was the first doula in the state of Nevada to become a Medicaid provider. This has significantly altered the trajectory of my business and clientele in amazing ways. I'm also married to an amazing man in Reno, Nevada, where we live full-time in our renovated RV. I'm a runner, a minimalist, and healthy lifestyle enthusiast. Personally, I've experienced infertility up to IVF and 3 miscarriages, one of which was twins at 16 weeks gestation. I've had 1 hospital birth and 3 home births with midwives, 2 of which were water births. I breastfed 7 children, including 3 of my adopted babies, for 11 years in total, relactating for 2 of those adopted babies. I have a huge blended family and have suffered the loss of an adult son. Today, I'm excited to talk to you in this brief presentation about the decision to become a Medicaid provider. As I said in my intro, I was the first doula to become a Medicaid provider in the state of Nevada on December 1st, 2022. As I'm recording this, it's been coming up on 7 months since then. And the last 7 months has been challenging because it's learning not just one system, but many systems. And depending on the state that you live in, things will be slightly different, but I'm going to try to go over an overview of what to expect. The first thing that you need to do is become a provider with your state. That is kind of the overarching umbrella, and you have to have that information in order to continue on. In the state of Nevada, we only bill to the state if it's somebody outside of the 2 main counties that are within our state. So any outlying smaller area, tribal communities, we would do billing through the state. There are some special considerations. I had one client that had dual residency in California and Nevada, and she was 17. I'm not sure which part of that made it so that I billed to the state, even though all of our meetings and her birth were done in the county, but there will be special considerations. The bottom line is every single thing you sign up for is going to take time and effort and not be the most fun or easiest thing you've ever accomplished, but it's completely doable is what I want to let you know. This is not a quick and easy process, and there are definitely frustrations along the way. I personally think it's worth it, so I encourage people to do it. And I am now the Doula Co-op of Reno, is a nonprofit that helps doulas become Medicaid providers, and I am their MCO liaison. So I work with doulas once they have gotten that state licensure that I just discussed, becoming a provider with the state. That's the first thing. And then you go on, CHQH is our portal. This is a great portal because it's a place where you can put all the things about you. Everything, all your information, all your certifications, what you do. And some, not all, of those Medicaid MCOs will go into that portal to gather your information. So when that happens, it's really time saving. You're not sending emails back and forth. You have to keep up on that portal. You have to make sure you update the registration every 120 days. You have to go back on and reactivate it. You also have to make sure that you're updating your certifications and anything that's new that's happening. We also have another portal called Availity. And some of these may be the same across the board and others may be different. I'm going to talk about what we have to do in the state of Nevada to go through this. Some of these portals may be exactly the same in your state. There are several differences, though, in the state MCOs and how they do things. So if it's different, that's also not unusual. Availity is the next site that we go on. This is a site that also gives information. It's a third-party clearinghouse. And again, some of the MCOs will get certain information, or you can use that verification on Availity. They'll want that information. Anthem Blue Cross, you actually do the application through the Availity portal. So the Availity portal does a lot of different things to get your information up and running. Once we have those two websites dialed in, we start the MCO process, and they have to be completed. So it's not just, I registered for CAQH, but I still can't do this. You actually have to finish the entire process with Availity and the entire process with CAQH. You'll get numbers that you'll use for the MCOs. You'll be asked for information from these two websites. And then you start with the MCOs. We have 4 in the state of Nevada. Anthem, I already mentioned that you actually do the application through the Availity portal. We have Silver Summit Healthcare. We have Health Plan of Nevada, and we have Molina. So that's where things definitely are going to differ, where you may have 2 of the same MCOs that I have, but you may have others also. And then you need to individually become a provider with every single MCO. One thing we're figuring out in this state, one of the parts of my job as the MCO liaison, is to talk to my point person at each MCO and ask them, how can we streamline this process? One thing I want to remind you is that this is brand new for them also. They have never helped a doula through this process. It was just October 1st, 2022. Often when they are helping people become providers, they are medical providers, and doulas are non-medical providers. So the amount of paperwork and information that they need to process our provider is much less, but you kind of have to work through that with each of the MCOs. Once you're done with the MCOs, you'd think, oh, great, this is awesome. And it is, however, then you will come to realize there's a different claim submission for every single one of the MCOs. You are a provider through it, and then you go to their website that allows you to submit a claim. Once you've submitted a claim, and look, starting out, I did this, I was mailing in paper claims. And it's not the end of the world if that's how you have to do it, because this is a process. Once you can do that with claims, you've actually, hey, here you are, you're on the website, you are submitting this claim. Getting paid is generally also a different website portal that you have to sign up for and get approval on. And what that does, basically, the claim website says, yes, we're processing this claim. They contact the billing portal website and say, hey, we're giving you this money to send to Jennifer through direct deposit. If you don't want to do that, look, you could submit a paper claim every single time and get a check in the mail. In my experience, it doesn't take a really long time for that to happen, but it's also not as easy as direct deposit. The downside to direct deposit is that it is one more billing portal for each of the MCOs that you have. Sometimes some of them double up, but often you're looking at 4 MCOs, 4 claim portals that you have to use to submit your claim, and 4 different billing portals to get that direct deposit done. The state, for us, fortunately, it's all in one portal. It's a little bit more streamlined if you can build through the state. So when that happens, I'm always very happy. So let's get into the pros and cons. Why do you want to be a Medicaid provider? Here you are, a doula. Many doulas became doulas because of a traumatic birth experience. They want to make a better birth experience for other women so that, you know, you don't have to go through the trauma that I went through in the hospital. Many of us, including myself, for the time that I was in Alaska and I was a birth assistant, off and on for about 7 years, I exclusively did home births. I can tell you statistically, and this is different everywhere, in Reno, Nevada, where I live, I have a friend who's a doula who has been a doula since 2011. And already 3rd week of June, she's booked up for her entire year and starting in January and February. And you think, wow, that's great. What a thriving, wonderful practice. And it is. but she only does about 4 or 5 home births a year, and she does 4 to 6 births a month. When I got back into this space, one of the big things is, how am I going to get clients? Where are they going to come from? How am I going to spread that word of mouth? Referrals obviously take time. I still was planning on being a home birth doula predominantly. I started out that way. And it wasn't a bad thing. It wasn't going horribly. And then in October, this situation came up that we could be Medicaid providers. I'm a very logic-based person, but I do generally get a gut reaction when I know something is what I want to do or what I don't want to do. And I immediately knew that this was something that I wanted to do. My biggest reasons are, this is a demographic of women that has never had even an option of having a doula. Many of them don't know what a doula is. They don't know what their options are in healthcare. They are oftentimes have no support at all from family. They're in much different situations. I'm going to try to talk about things that are often stereotypes, and I'm not trying to label or stereotype women who have Medicaid. We know that they have to be a certain income level or lower. I can tell you that in my state, 33% of pregnant women on Medicaid are also opioid drug users. We have a higher chance of teenage pregnancies and medical complications. This is where some of that stereotyping comes in. It can be often lower education coming from situations where there's been a lot of trauma outside of birth. This was so exciting to me. If you're hearing that and you're like, that is not for me, I get it, because we all have to find our niche. I feel like I had had enough experience. And although I was so excited and still am excited to light candles and use massage oil and be in someone's home, have a water birth, give this woman the best home birth experience, especially if she's had something traumatic prior, I don't not love that anymore. I just know that those are the women that have the highest education and are already advocating for themselves. And there are lots of doulas that will be happy to jump in and be their doula. When I heard about the Medicaid population and I thought about that demographic, it just really kind of lit me up. These are women that need us the most, that have the least chance of having a doula. So here are some of the pros if you're interested in becoming a Medicaid provider. Access to clients. When you're thinking about, how am I going to grow my business? Where am I going to get clients? How am I going to do my marketing and advertising? And do I do Facebook ads, Instagram ads, and all the things, right? You become a doula to be a doula, and then you have to run a business, which is not the same as being a doula. And often we don't know what we're doing in that realm. You have access to clients. Once you're set up with each MCO and you have a contact person, I encourage you, start a relationship with them. Meet them in person if you can. Have Zoom meetings with the team. Really get to know who they are. Some of them have nurses locally. Health Plan of Nevada is one that does that really well. Of the 4, so far, they've been the best at this. They have a nurse that tracks all of the pregnant women that have Health Plan of Nevada. They know about them. The other thing that Medicaid has is they have case managers, people who go to these women's homes that figure out what other services they need and can give you a really good overview of who this woman is and what she's like. So you get a lot of outside information on those referrals that are being given to you. You're not working for them. I will have a meeting and say, I can take 4 clients a month for July through December. I would like you to send me 4 a month. These are the things that I love to do. These are the things where I'm not as good of a fit. The nurse knows my personality. And even if there were 25 doulas in Reno, which there aren't, that were all providers, which there are enough clients for, that nurse could get to know all of us. So I know when I call Health Plan of Nevada and I talk to them, I know them, I've met them, I know what they look like, I know what they laugh like, they know me that well, and they know their clients and they're going to refer them to me. It's wonderful not to have to worry about how to access clients. Also, I have put information on my website and my social media that I am a Medicaid provider. Women who read that get in touch with me and they ask me questions about, like, is it even possible for them to have a doula while they have Medicaid and they don't have to cover the cost? Yes, it is. Another thing that happens that's a pro, and I talked to you about the care manager. There are a lot of different programs that Medicaid has. Through that, you start to get to know about all these programs in your community that maybe you were not aware of, or if you were aware of, you never really looked into. All these programs that these pregnant women are being tapped into, you start to get to know about all of the available things in your community. You start to get to know the people who run those places, and it's just more connections, which builds rapport in your community, helps you with your referrals outside of yourself. I'm really, really big in my doula practice. When I have a mom and she needs something, I'm not the be all end all. I'm not going to be able to do and be everything this woman needs throughout her whole pregnancy and postpartum and beyond. And I do not want women to feel unsupported. So it's really important to me to know all of the different community businesses that we have that help support women. And these case managers with the MCOs helps you be able to get to know all of those. I mean, you're automatically learning about it as you go, because this client that you have that was referred to you needs these things. This is who they are and what they do, and you can get in touch with them. So you're building a lot of community relationships and referral sources. The great thing about me having a referral source is I'm doing this so that my mom gets the best care she can get, but I'm also setting things up with people to establish relationships that they refer back to me. So it's another way that you're also getting access to clients outside of those individual MCOs referring to you. The other thing that I see as a real pro is learning. The medical issues that some of these women come with are unique, things that you're not going to see in your normal doula practice. For example, I had a mom a couple months ago who was 17. She had cystic fibrosis. She was immunocompromised. She had cholestasis and she had STDs. So during her labor, she actually had 2 cystic fibrosis lung treatments. I had to learn, what is cystic fibrosis? How does it affect the mom? Not in a lot of depth, but enough to be there and be a good support. Who the department was that was going to come and give her that breathing treatment, how to talk to that person when they came into the room. There was a lot more going on in that room and in her situation, in her labor as a whole. And it was her first baby and she was 17. When we get clients through Medicaid, and this is something that I love. I love being in the OR for a C-section. Do I want a woman to have a C-section? Not particularly, but in the 10% of the time, 4 to 10%, we could have an argument about this, but in the much lower percentage that C-sections are necessary, my goal is the same. I want that woman to have the best, most positive birth experience possible within that situation. So I love the OR. I love medically complex cases. And it's just really interesting to be able to kind of geek out and learn about situations that there's no other way that I'm going to learn about all of these things. And I'm not a medical provider, so I'm not put on the spot. I don't have to do anything different. I just have to be there in a way that can support this woman. But educationally, it's a great system. The cons. I went through the how-to in the beginning. I've gone through the pros. One of the cons is actually becoming a provider and getting registered with every single portal that you need to get registered with, and learning the process of how it works. What are the steps outside of, you get the referral, you see the patient, then how do you bill it? How do you get paid? How do you maintain all of these different portals that you're doing? Not hard, not overwhelming. It is a learning curve and it can be frustrating. Dealing with the MCOs specifically can sometimes be frustrating. Where I said Health Plan of Nevada is my absolute favorite to work with, there are 2 other MCOs that are equally good. So HPN's great. 2 that are really good. I really dislike working with Anthem. Within this whole myriad of all of these things, I would encourage you to keep a Google document of the process of each one, maybe a spreadsheet, maybe both, but definitely a way to figure out. You'll get lost in the emails. I've been emailing 2 different MCOs just today, and both of them were emailing me about their billing portal. And I got lost in which billing portal went with which one because emails were just flying back and forth. And when I had to call one of the billing portals and they said, well, which MCO you're calling about, I was like, hang on, I got to regroup. I'm very good at keeping detailed information all lined up. And you can't do this without having the information very organized. If I accept 4 clients through Medicaid a month in the state of Nevada, we have 4 visits that are approved and 2 that are conditional. 1 is approved if the OBGYN signs off on a paper, and 1 is approved if the mom has had a dental visit. We're still trying to figure out the best way to keep track of those 2 pieces of paper. It's most likely the care management team, like, hey, she went to the dentist, she got the sign off. She went to her OB, she got the sign off. And that means we can have those extra 2 visits. That gives us 6 visits. I break that up into 3 prenatal and 1 postpartum. And if I get an additional 2, I do them on the postpartum end. The reason I structure it that way is that it can take an entire pregnancy to get to the dentist and to get that sign off on the OB. I want to make sure that if I have 6 visits, they've gotten 3 prenatal and they at least have 1 postpartum. Like, you have to tack them on at the end, essentially. So 1 client has 6 visits and 1 delivery. So there's 7 different things that I have to bill for with every single client. 4 clients, each with 7 visits, is 28 times that I have to go on, file a claim, and follow it, track it, and make sure I get paid for it. I don't know that this is a con. It is a change in my business, where before I thought, well, if I have a little extra money, I'd like to hire somebody to help me out with social media. Now I want to hire somebody to do billing for me. Without Medicaid, with self-pay, you never need to consider that. I don't see that as a con. I see that as a business possibility that you can spend some of your money on. But if I'm getting fed 4 to 6 clients a month, if they're being referred to me and I'm not doing anything to have them come in and I have a steady source of income, part of that is hiring somebody to do billing. Again, I don't feel like it's a con, but it's definitely something you need to be aware of and a place that money is going. And that's why I put it under the list of cons. Another thing you have to consider with home births, you're going to the person's house to do all of your visits. With hospitals, you have to figure out where are you going to meet these people. And with Medicaid, 100%, you have to figure out where you're going to meet people. To streamline my time, my driving, I want to have 1 location that's not at my home where I can have meetings and set aside a couple days a month, 2 to 4 days a month, where that's what you do. You're at this location and you're meeting with each of your doula clients to go through your prenatal and postpartum appointments. That's not different for me. I was still finding locations to meet people at or doing that via Zoom. It's more of a priority with Medicaid clients because going to their house is sometimes not an option. One thing, another pro, is that Medicaid does pay for women transportation to your visits. So there's not a reason for this woman to not be able to come. It's just a matter of setting up the paperwork with that care provider so this woman is getting rides to all of the visits with you. But it's not an additional expense to them. To wrap up this presentation, and I hope I've given you a good basic idea of how to become a provider, the pros of being a provider, and maybe some cons of being a provider. I want to end with, this is the toughest demographic of women that I've worked with, in the sense that you're doing a lot more education and there are a lot more medical things happening with them. Sometimes they come from really serious situations. I have had one client this year where I had to go out into the hallway and talk with the nurse that was assigned to her about a situation of potential domestic violence and giving her options for that, which is not what I do, but it is what the hospital staff does. It is what the nurse did. These are tough situations to deal with. On the flip side of that, every birth that I've attended is euphoric and amazing, sometimes stressful, exhausting, but really so worth doing this work in the hospital with women who have Medicaid that would never have this option otherwise. I've been able to give them something that feels like so much more. When a woman advocates for herself, is educated, seeks you out, and wants a doula, that is a wonderful thing. When you don't have those things and you're referred to someone and you show up and you meet them, at the end of the birth, I cannot even tell you the gratitude that these women have that you were there. They may not have even completely understood what a doula did, why to have one there, what's my role, is it even necessary or worth it? I can tell you that once that delivery happens and you're visiting with them after, the level of gratitude is just so overwhelmingly wonderful. And the knowledge that I can serve a demographic of women that have been discounted from the option of having a doula, it was 100% worth completely changing the trajectory of my business and working almost 100% with women with Medicaid as a Medicaid provider. If you have any questions, I love to chat. I love to communicate and collaborate. So please reach out. I'm happy to answer any questions. Like I said, there are differences in every single state. So I don't necessarily have the answer for you specifically, but I can probably point you in the right direction. And I'm just so grateful that I've been able to share this information with you.